The challenge I would make to those opposing health reform is this. Where are your proposals to privatize the Veterans Administration? That's government health care. Where are your proposals to privatize Medicare? That's government paid for health care. If other countries have government health care and government health care is so terrible, why aren't they repealing it? Government paid for health care works. And you're just not seeing the facts if you don't. If you saw the facts, you'd be pushing for privatizing the Veterans Administration. The position of those opposing health care reform is not consistent, and it's not consistent with facts everybody knows. Health care is a right, not a privilege, and it actually saves money when societies recognize that.
We have 46 million Americans without health insurance. We have insurance companies running the medical health industry for all of us. They deny, they delay. We have people dying because they don't have insurance or the insurance is denying their health care. It's time for reform, and time for reform now. The Americans spoke in November. They have spoken ever since. We are looking for health care reform now.
When my COBRA coverage ended after 18 months after I retired, my insurance doubled to more than my mortgage if I kept my prescriptions. But thank goodness for Target and some of the other ones where I can get my generic drugs. But it would have been more than my mortgage if I had kept the Kaiser Permanente plan that I had under COBRA and before COBRA, before I retired. People are living in a la-la land. The wealthy are deciding what's going to happen, and the middle class need to be heard.
Hi, I'm for the health care reform, and I believe that everyone should have health insurance. Currently, there are 47 million people without insurance, and everybody in the United States should be able to have health insurance, from the youngest to the oldest. We are eligible for health insurance if this bill passes. Thank you.
My son and I are out here today because healthcare reform is very important. We're the wealthiest country in the nation, and the fact that everybody doesn't have healthcare is a shame. So there are a lot of plans out there. There should be discussion, and that's what we're asking for, is that there's actually discussion on getting people access to quality healthcare. Most people won't disagree that young people should have it. They agree that our seniors should have it. And now we're talking about the large working poor, working middle class that are having to decide between food and healthcare. And so what we're trying to ask for is actual discussion on it. Lots of different plans, but we need the opinions of everybody. People should have a choice of their doctors, decide where they want to go, and get rid of all the rhetoric, get rid of all the yelling, and really talk about what's important to America. If people have health insurance, then it's more likely that they'll be able to start new businesses because they don't have to worry about deciding whether to stay out of business, a job that they may not like, only so that they can keep that health insurance. So anyway, that's why we're out here today. We need health insurance reform, and we're asking everybody to support us and look at the plans, ignore the rhetoric, but let's have an honest, thoughtful discussion. Thanks.
I'm with the NAACP, Carroll County branch. This year I'm running for state president of the Georgia State Conference of the NAACP. We are here today supporting the Obama plan of health care reform. We've got a lot of elderly people that I am hardened about every day. I hear that they have to make crucial decisions between the purchase of medicine or food or paying their rent. This is a very dreadful thing on the elderly, people that have worked in this country to help promote this country, and we pay them back by not giving them affordable health care so that they don't have to worry about whether they have medicine or not.
We're in David Scott's Representative Scott's office. We're trying to get the opinion about different people, about what they think about the health issue. I'm from OPP Studios in Smyrna, Georgia, and I've been trying to get some individual interviews with everybody who is present in here. I've been trying to get the Obama side or the health issue side, and I've been trying to get the people who are not, with the health issue. But people who are not in the health issue refuse to talk to me because they believe I'm in Obama's side or because I'm wearing blue. But that is not the case. I'm an independent media, and I've been trying to get their views
but they will not talk or they will not share their views with me. Thank you, America.
And state our support for healthcare reform, however, not by massive government taking over of the healthcare. We got word through the Marietta Daily Journal yesterday, Friday's paper, that I guess what is it, the Cobb chapter of the NAACP, MoveOn.org, and some national active network of some sort. We're going to come out here for a counter demonstration. We assumed it was a counter demonstration because we've had this plan for so long. It's been on the internet, and then all of a sudden there's been a small group of us got out here at about 9 o'clock this morning thinking if they were coming, we would make a presence as well.
On the latest level, why does this group and the groups who are like it around the country oppose this health plan?
We are opposed to a massive government takeover of the healthcare. We know that healthcare needs to be reformed, but there's a right way and a wrong way. The wrong way to do it is what the Obama administration and in particular what Congressman Scott is proposing, which is the public option and a government control. If anybody were to read the bill, they would see that it's just a massive growth in government. Putting that on top of what they've done so far when it comes to all the stimulus and all these other the cap and trade, and just yesterday the government came out with new debt numbers. This is the wrong way to do it. And so what you have here are a group of just concerned citizens saying, yeah, let's reform healthcare, but let's do it right. So there may be a lot of things that we agree with. However, nobody wants to listen to us. They call us instigators. They call us troublemakers. And Congressman Scott has called us several things, hijacking his meeting. And all we want to do is have a real dialogue on what is the right healthcare reform.
What is the right healthcare reform?
The right healthcare reform is a common sense approach where we use market influences. The wrong healthcare reform is where we let government take it over. If government says they're going to bring in competition, but government never has, and anybody that is legitimate and will look at the facts will realize that government is inefficient on almost anything it does. And for us to believe that it will somehow be the magic pill and make healthcare reform efficient, I think that person is not being honest. They're being more of an ideologue, which we run into a lot, as opposed to somebody saying, what are the real solutions to healthcare? Market influences. Let the private sector, get a group of private sectors like doctors. Listen to all the doctors, the insurance companies, not the big insurance companies, but the people who have to go out and do it. The small business, like I am. We have to go out and buy these coverages. How much are we going to contribute with our employees towards these things? All of these things are good questions that need to be addressed. But government is not the solution to these.
What about the people who say there are so many poor people that can't afford health care and this would help them?
See, and that's what's confusing to me, is for someone to say, well, they can't afford it because they're poor. Well, if we were to reform it right, it would become more affordable. And then whoever said that because we want the private market and the private enterprise and capitalism to reform it means that we don't think we should have a safety net. We believe there should be a safety net. But to believe that government's going to be the solution when you look at government and governments across the world, then that is being naive.
Thank you very much, Randy.
You're welcome.